The House Appropriations Subcommittee on Health and Human Services will come to order. Clerk, please take the roll.
Chair Morse.
Here.
Vice Chair Martis.
Here.
Representative Hood. Representative Brayback. Representative O'Neill. Representative Puri. Representative Farhat. Representative
Here.
Bright.
Here.
Representative Skaggs.
Here.
Both sides, thank you.
Representative Snyder.
Here.
Representative Bolin.
Here.
Vice Chair Green.
Present.
Representative Meerman. Representative Kuhn.
Here.
Representative Steele.
Here.
Madam Chair, you don't have a quorum present.
Thank you, Clerk. Good morning, everyone. We are here for day 2 of our public testimony, where we provide the public at large with an opportunity to present on issues related to the Health and Human Services 2025 budget. We do have a number of people who RSVP'd to the clerk. We will call them in order as per the agenda. If you have just arrived, we have cards at the entrance and in the room that you can fill out. If you haven't already RSVP'd, you can fill out a card and get it to us, and we will call you. Everyone is going to be allotted 3 minutes. We will bring it to your attention as we are getting closer to the end of the 3 minutes, and then at some point we will have to move on. So we ask for everyone to keep within that 3 minutes to the best of your ability. These are very, very, delicate subjects, and many times, and people are sharing their personal stories, but it is our responsibility to give equal time to everyone. So that is why we do it that way. We will allow time for the committee members to ask questions. So after you've wrapped up your testimony, we will open it up to questions from the committee members. And with that, we will get started. So first, we will recognize Dean Lori Clabo from Wayne State University.
Thank you, Madam Chair, members of the committee, for the opportunity to talk with you today. My name is Lori Lozon Clabo, and I am the Provost and Senior Vice President for Academic Affairs at Wayne State University. And I'm pleased to provide you with an overview today of our proposal for an initiative to address the critical healthcare workforce shortage in the state of Michigan. Many of the programs designed to address workforce shortage have really dealt with getting more people in the pipeline and have missed some of the evidence-based strategies that we know could improve both access and retention to healthcare workforce in the state. So we're proposing a largely three bucket initiative. The first, strategies designed to enhance the workforce pipeline. As you know, Wayne State University provides about half of the healthcare workforce for the state of Michigan. And we are looking at ways to address the critical nursing faculty shortage, which really limits the number of people in the pipeline. Largely, our ability to enroll additional students in the state of Michigan is related to a shortage in nursing faculty. Less than 1% of nurses in the United States possess the credentials required to serve as nursing faculty in baccalaureate and higher programs. We believe that we can, by doing 3 things, address that shortage, and those 3 strategies are described in detail in the one-pager budget that you have, but largely topping up clinician salaries to allow them to serve as educators for a single day a week to provide clinical education as adjunct faculty would have an incredible impact on opening the pipeline for workforce. Additionally, we propose the adoption of joint academic practice new residency programs. And those programs have been shown by research to address turnover in the first year. In many of our healthcare systems, as many as 40% of new graduates leave their first job in the first year. And of those who leave, 20% leave the profession entirely. Jointly designed academic practice new nurse residency programs that pair a new nurse with a faculty member as well as a clinician for support have been shown to reduce that turnover by more than 50%. And finally, we propose the adoption of some new research programs to address strategies for clinical education in our existing programs. There are models of clinical education that we believe can increase productivity for the clinicians as well as decrease the likelihood of turnover in new graduates, and those have yet to be studied here in the state of Michigan. We propose a rigorous program of research that would direct new models of clinical education to support our critical workforce shortage. And with that, I will conclude. Thank you.
Thank you so much, Dean Clabo. Do we have any questions from the committee? Okay. Seeing no questions, thank you, Dean Clabo. We appreciate your testimony today. Moving on to Taylor Barker and Jim Tim of MyBat.
Oh, thank you. I think John was going to go first, and he's in person.
Thank you, Madam Chair and members of the committee. My name is John Tim. I'm the founder of North Arrow ABA. We're a provider of applied behavior analysis services based in Traverse City, serving most of the northern lower peninsula and the eastern upper peninsula. I made the very early drive this morning to support the proposal to increase the reimbursement for our direct care workers to $70 per hour. This is necessary for Michigan to remain competitive when other surrounding states have adopted similar rates. We are losing providers currently in the state, and as a small business owner myself, I see those challenges for recruitment. The House Fiscal estimates a $12.4 million general fund share, total of $36 million medical or Medicaid funds. In addition, we want to continue to support staffing in this very challenging position. And I'll hand it over to Taylor.
Thank you, John. My name is Taylor Barker. I'm also a member of the MyBat Board of Directors, and I'm also a small business owner. My wife and I started our program to serve children with autism in Genesee County in the spring of 2020. And at that time, we worked for a year and a half to develop a contract with our local county's Medicaid office. And after serving Medicaid clients for about a year, we had to abandon our contract because the rates were no longer sustainable for us as a small business, where my wife was not getting paid and I was getting paid the least out of everyone on our payroll to be able to provide these services for children with autism. And so I provide that as just an example of how much of a crisis we are in being able to support these children with the diagnosis of autism. And I'll reiterate what John had said, that we have nationwide providers currently that are leaving the state of Michigan because the rates are no longer sustainable. We've had 3 in the last year leave the state with no one to take up the slack of those kids, so those kids were left without services. And so with that, I will concede my time.
Thank you so much for your testimony. Any questions from the committee? Okay, thank you for being here today.
Thank you.
Next, Patty Sabin from CASA. I did not see her. Okay, we'll call her back up. Thank you. Melissa Workman, President, Children's Advocacy Centers of Michigan.
Good morning, Chair Morse and members of the committee. Thank you for taking the time to listen this morning. I'm joined by my colleague Alex Brace, who's the Executive Director of Small Talk Child Advocacy Center right here in Lansing. As you may already be aware, child advocacy centers across the state are facing a 41% cut to the Victims of Crime Act federal funding in 2025. This comes at a time where we were already experiencing a significant deficit in state and federal funding for our critical services. I represent the 40 child advocacy centers across the state of Michigan, like Alex's, that already were reeling from the impact of those cuts, facing cutting critical services, laying off staff, and greatly impeding the ability for our multidisciplinary teams of law enforcement officers, child protective service workers, prosecutors, medical examiners, therapists, victim advocates, and forensic interviewers to be able to have an effective investigation, but also to provide children with the immediate trauma-informed services that they need in order to get back on the path of healing. In addition, just on Friday, The Economist Impact released the Out of the Shadows Impact Study. The study measured 4 metric areas in terms of states' individual responses to child sexual abuse. Of the 28 states that participated in that survey, Michigan ranked overall 25th out of 28 in terms of our collective response to child sexual abuse. The 4 metrics included state legal protections, criminal provisions, investment in prevention capacity building, funding, and the adequacy of support services. In short, we have a long way to go to come around our children and our families and our community. The impact of child sexual abuse on one child amounts to over $300,000 over the course of a lifetime in terms of economic impact. With that, I would like to turn it over to my colleague Alex so he can talk with you directly about what this means on a local level for a child advocacy center.
Thank you, Melissa, and thank you, committee, for the opportunity to speak with you this morning. As far as the impact to our local children's advocacy centers, the biggest impact is, of course, to the children that we serve. These are children who are often, have experienced years of abuse, who require services that we provide. All of the services that we provide at children's advocacy centers are provided at no cost, and we've seen the need for these services increase over the years. So without the funding to match to make sure that we can, provide these services, children are going to go without the critical healing that they need to be able to live a happy and productive life. Without the advocacy centers in our communities, children are going to have to go back to completing their forensic interviews at a law enforcement agency, potentially in front of a uniformed officer. And when we're talking about children who have been impacted by trauma and abuse, it's really important for them to have a child-friendly, safe space to be able to come. And we want to make sure that we can keep the professionals that are providing the services in the children's advocacy centers, again, to be able to provide those free and no-cost services to children immediately in the aftermath of their abuse in order for them to heal.
I want to thank this committee and our lawmakers for the commitment that has already been shown to our work. Last year, we were really grateful for the $2 million that was offered to us through the supplemental fund. We are still at about a $10 million shortfall, and that is, again, before the expected 41% cut to VOCA next year. Many states, including 2 of our surrounding neighboring states, Wisconsin and Illinois, make a significant state funding allocation to child advocacy centers. We're about 10% compared to what those states provide. And so we appreciate and are happy to partner with you to come up with solutions in terms of funding, whether that's a larger funding opportunity through the general fund or through special fund allocations such as license plate promotions or other fines and fees collected from for instance, individuals who are found to be soliciting or sharing sexually explicit, harmful material involving children. So thank you for your time this morning. We're happy to answer any questions.
Thank you both for being here. Rep. Price?
Thank you, Chair Morse. Thank you for your testimony today. Of course, we want to make this investment to help support our kids, no question. But I'd like you to talk a little bit more about that economic impact. What are some of the factors that contribute to it, and how does your work help alleviate those factors?
Sure. You may be familiar with the adverse childhood experiences scale, and this takes a look at extenuating circumstances that might impact children under the age of 18 over the course of their life. And it looks at many factors, including mental health, physical health, ability to stay in school, pursue a career, be responsive and wholesome parents to children as they continue throughout their life course. So the lifelong economic impact looks at all of those factors, including an adult's ability to be able to overcome the adversity faced by the trauma and the impact of their trauma, to pursue a degree, or some sort of technical experience, to hold down a job. We also know that individuals who face this kind of trauma tend to have a exponentially higher proclivity toward alcohol and drug abuse, serious issues with mental health, including exponentially higher rates of suicide, depression, anxiety, a lot of maladaptive behaviors that come along with untreated and unresolved trauma. So over a lifetime, that can become very costly to us as a society, and an incredible generational impact as well.
Rep. Steele?
Thank you. Just real quick, could you, I don't know if I missed it at the beginning, the amount that you were asking for and the number of children that you're able to help and that you have helped maybe as a last year, and then was it in the entire state or was it in a specific area in which you're an advocacy for? So thank you.
Yeah, absolutely. So the Children's Advocacy Centers of Michigan, we support 40 child advocacy centers across the state. Presently, we have child advocacy centers in 75 of the 83 counties in Michigan. Our goal is ultimately to fill all the gaps in the map and provide services to every child. With regard to the funding, our ask was $12 million last year to bridge the gap of shortfall we already had. We appreciated the $2 million in the supplemental, but we are still at a $10 million shortfall, and that is our ask right now. The number of children over the last 3 years that child advocacy centers in Michigan have served, and that is in terms of providing forensic interviews. From there, a child will go and hopefully be able to receive the full complement of services such as victim advocacy, court support, therapy, medical exams. In the last 3 years, we served over 30,000 children collectively. We know we are missing a lot of children. The estimates are 1 in every 10 children under 18 will be sexually abused, and that holds true for here in the state. So we're missing upwards of close to 100,000 children in those services. So the need is very great, and it's increasingly more complex, given the nature of the crimes and also the incredible pressure on kids and the much higher level of mental health comorbidities, if you will.
Well, thank you so much for being here, and thank you for your work. Appreciate it.
Thank you, Chair.
Next, we'll call up Dorothy Pintar, School Success Partnership Program.
Good morning, members of the committee, and thank you for allowing me to speak on behalf of the Northeast Michigan Community Service Agency School Success Program. I'm Liz Skiba. I'm the area manager for the School Success Program. I'm here on behalf of Dorothy Pintar, our program director. She's unable to be here today. But I'm really excited to tell you a little bit about what the program is about and just talk about our successes, and thank you for your support and continued support of our program. I'm not here asking for an increase in funding, but just for your continued support at the current funding level. The School Success Program is a prevention program that identifies students who are at risk for academic failure. There is a home visiting component and also a very successful truancy reduction component in this program. The School Success Program began over 32 years ago in response to community awareness that school failure was a complex, multifaceted issue linked to chronic poverty and other life challenges, including poor attendance and youth mental health. This program has become an integral resource for students, families, and schools in our 11-county service area in Northeast Michigan and has been made possible by your support. And starting in 2014, we were able to expand the program with the help of state funding. So I just want to draw your attention to documents A and B. If you have the materials in front of you, you'll get a nice overview of how the School Success Program works and what our liaisons do. We believe that good school attendance is the single most important factor in making sure that kids get a good education, the best education possible in life skills. There are no income guidelines for the program. Anybody can refer a student for any reason. With parent permission, the student's enrolled. It's really as simple as that. As you can see in document C in front of you, our 4 performance objectives. If you just reference that, that's our program dashboard for 2022-23. That just gives a really good breakdown of our objectives: increasing school attendance and decreasing chronic absenteeism. We had a 98% reduction in absenteeism, increasing academic performance based on grades, and we really focus in math and reading, and the overall academic improvement was 79%. Identifying barriers to attendance and success and connecting families with resources to reduce these barriers. Over 7,000 barriers were identified and alleviated that year, and increasing parental involvement in the child's school and community. And we had a 98% improvement in parental involvement. So that's just a breakdown of how our dashboard works, and we do that every year to kind of see how we're doing. So we'll look forward to the end of our school year this year. But in your packet, you also have document D, which gives a really nice overview of our significant reduction in absenteeism. Document E shows our expansion that we were able to make in 23-24, adding new sites and positions, and there's a breakdown there in that document. Document F is our mid-year snapshot, just to keep track of how we're doing this year. And there's a really nice article there from our former assistant prosecuting attorney, who's been a huge supporter of our program. Document G is a outline of our Governor Service Award. We're very proud of the Youth Impact Award that we received this year from the governor. And then last but not least, you'll see in document H, a breakdown of a student that is involved in our program. And we just like to share our little success and how that impacts kids and the workers that work with students. Finally, the School Success Partnership Program is a very cost-effective way for the state of Michigan to serve K-12 students and alternative ed students. Please continue to support the educational and mental health needs of Northeast Michigan students by continuing to fund our program for years to come. Thank you so much for your time, committee.
Thank you for being with us today. Do we have any questions from the committee? Seeing no questions, thanks again. Next, we have Ryan Beals, CEO of the Live Network.
How you doing? Good morning, Madam Chair and honorable members of the committee. I'm here today to respectfully request an appropriation of $2.5 million to support expanding and implementation of the Prepare You Pro program in Michigan. Prepare You Pro is a vital mental health initiative providing evidence-based preventative interventions. Through targeted educational interventions, Prepare You equips individuals with skills to identify and manage mental and emotional challenges effectively, involving families and community support as needed. It offers an advanced, self-guided, evidence-based 11-course preventative mental health experience where participants learn and practice proven tools to enhance their lives. Mental health issues, as you know, are prevalent in our state, and early intervention and education are crucial. Over the past 7 years, Prepare You's preventative education has positively impacted over 40,000 adolescents and their families with a perfect record of 0 suicides in the school districts that Prepare You has supported. Prepare You Pro further advances access to expanded populations and provides nearly 15 hours of evidence-based and life-saving and life-enhancing experiential education to those in need that need it most throughout the state, while bringing the same support to their family members in a culture and building a culture of mental wellness and shared language. My name is Ryan Beal. I'm the CEO and founder of the Live Network, or Live Network, the behavioral health team that created Prepare You. I'm also a two-time family survivor of suicide. I have a master's in clinical psychology, and I've worked as a crisis interventionist in Oakland County's Common Ground, facilitating several hundreds of direct contact pre- and post-crisis interventions. I was also a nominee for the Governor's Suicide Prevention Task Force. Over the past 15 years plus, I've worked in reducing stigma by developing state-of-the-art technology in prevention and evidence-based educational interventions. Prepare You being a game changer in prevention, having received world-class endorsements and support from the leaders of the American Psychological Association, the Canadian Psychological Association, and community mental health and behavioral health hospitals throughout Michigan and the country. I'm dedicated to saving lives and reducing the negative effects of intergenerational transmission of trauma. Prepare You Pro is adaptable, suitable for individuals and families awaiting therapy, those needing extra support in therapy, and people coping with loss and grief. It aids in transition age youth, suicide and crisis prevention, and supports inpatient and outpatient care. The requested $2.5 million will primarily purchase user licenses for Prepare You Pro, ensuring widespread access across Michigan. This funding will enable effective implementation in schools, community organizations, healthcare providers, reaching a larger audience and impacting mental health outcomes. In summary, Prepare You Pro is a proactive, evidence-based approach to mental health challenges. By equipping individuals with essential skills and support, it empowers them to navigate mental and emotional well-being successfully. I urge the committee to consider this request favorably, recognize its significant impact on our state's mental health landscape. Thank you very much for your attention. I'm available to address any questions, Madam Chair.
Thank you, Ryan. We do have a question from Rep. Braybeck, who's online.
Morning.
Okay.
Morning, Chair. Thanks so much. Good morning, Mr. Beals. Thank you for being here this morning. You talked about your experience at Common Ground. So, you were there, kind of front lines. Can you talk a little bit more about, your experience and knowing what it's like on the front lines to help work with the crisis that we have on our hands right now in Michigan? Can you talk a little bit about how you see the interplay between Prepare You and folks who are coming into different centers in terms of both access and accessibility and just general help in terms of what's going on for them at that moment?
Absolutely.
Thank you.
I mean, I could speak to it as a crisis interventionist. I could talk to it as a family survivor of suicide. But to answer your question, when individuals are in crisis, it's not just them, as you guys know, family as well. And a lot of times it's the support that they have around them. It might be their life circumstances. And obviously there's a biological component at times too. Prepare You, what it offers, especially for someone, for example, coming in Common Ground or crisis intervention, a lot of times, depending on the acuity of the individual, they are sitting around waiting, unfortunately, to find a hospital bed if they need to get that next level of care, or they're waiting for the determination of what the next level of care will be. Prepare You Pro provides them while they're either waiting and they're waiting to talk to a clinician, a psychiatrist, or to figure out what their disposition will be in their triage. Prepare You Pro offers the ability to give them educational tools that they can learn, they can approach, they can do mindfulness activities. They start learning how to process anger. They can do CBT, REBT tools, which, cognitive behavioral therapy. They can learn this while they're waiting. And they oftentimes have access to their devices. So they can do this on their phone, on a tablet, while they're sitting and waiting for hours and sometimes days for that next level of care. In addition, it's also a support as they leave, as they're doing follow-up care, to be able to have a tool that they can have shared language. And with the Prepare You Pro license, it's not just them. Their family members all get it. It's kind of like, let's say, like a Netflix account. They all get access, and they all can go through at their own pace. They're being given tools on measuring their level of meaning and purpose, on their level of anxiety and stress. And we also, understand, do research on the level of trauma. So every one of their family members has the ability to have shared language to understand what their family member and loved one is going through, which is a game changer in dealing with mental health. You know, obviously it isn't. We are hurt in group and we heal in group. So Prepare You Pro provides the access to many individuals, especially people waiting to get into therapy. I mean, the wait list at some of these organizations and even the universities is significant. And the ability to give Prepare You Pro to help reduce some of the symptomology. I mean, you're looking at about 15 hours of psychoeducation that really you don't find that time in a therapy session to get through. You know, it could take you 15, 20 sessions of just focus on just giving these tools to get there. So I hope that answered your question, Madam Chair.
That is really helpful. Thank you. And you just used the words that I kept thinking about when, you know, learning about Prepare You and talking about it, which is that vital psychoeducation component that dovetails really nicely into psychotherapy, but also you hit the nail on the head, and we talked about this last week, you know, kind of the crisis that we're in terms of folks waiting to get connected, whether it's to a hospital or a therapist, but also upon discharge planning, or upon discharge. So thank you so much. I really appreciate it. Thank you, Chair.
Thank you.
Any other questions from the committee? Seeing none, thank you for joining us.
Thank you very much.
You're welcome. Next, I see that Patty Sabin has joined us, so come on up from the Children's Advocacy Centers of Michigan. I'm sorry, Michigan Court Appointed Special Advocates. It's Monday, it's Monday.
Where would you like me, Chair?
Right
here?
there is fine, and you
Okay.
just have to turn on the mic there. There's a
Okay.
button for you. And if you missed the earlier part, you have 3 minutes. We have to give everyone equal time, so 3 minutes.
Dave
Okay.
filled me in, so
Okay.
I've got the short version.
Okay.
Okay. Can you hear me okay? Okay, good. Good morning. All right, calm down here. Good morning, Chair Morris and members of the committee. I truly appreciate being able to speak with all of you today. My name is Patty Sabin, and I'm the President and CEO of the Michigan Court-Appointed Special Advocate Program, which is CASA. The children of Michigan who are wards of the court because of abuse and neglect are mired in a challenged system through no fault of their own, and one that does not allow for individual advocacy. Michigan CASA provides just that, unbiased individual advocacy in its very purest form, with the only agenda being the child's. CASA is uniquely designed to provide this best interest advocacy. We are the only child advocacy group in the state of Michigan. Our guiding principle is that children should remain with their family of origin whenever that is safely possible. To give you a quick program overview, Michigan CASA is comprised of 25 programs serving 30 counties with 768 volunteers serving over 1,400 children. Our ultimate goal, though, is to serve every county here in the state. Michigan CASA is part of a national network of 939 state and local programs in 49 states, including the District of Columbia. Who are these court-appointed special advocates? They are caring, committed community volunteers who are carefully screened and go through extensive training. They're sworn in by our courts and are considered officers of the court. Our judges appoint CASAs to typically their most critical cases, and they value their independent voice. The CASAs, through their investigation and building relationships with all parties to the case, and through their quarterly reports to the judge, help judges make the most well-informed decisions. Our judges state they read the CASA reports first to get a true sense of what's going on. And the CASAs stay with the case until each case is closed. And this is one of the many benefits of a CASA volunteer assigned to a case, because they are with that child and until the child has achieved permanency. A typical case will have several foster care workers, foster care placements, teachers, therapists, but only one CASA volunteer. They visit their assigned children once every 7 to 10 days, and visits could be anywhere from coloring books in the foster home, to throwing a Frisbee in the backyard, to having a chocolate shake at McDonald's. The training curriculum, which is 34 hours plus a 12-hour continuing ed requirement, has been developed by the National CASA and is mandated as such. So that means a child in Menominee County is going to get the same quality advocacy as a child in Ingham County or Oakland County. I'd like to share 2 stories about our volunteers and what they've done. We did have a volunteer that tracked down high school credits for his CASA youth who was just starting his senior year. The young man had been placed in 12 school districts during his high school career. This is pretty common. Because the volunteer was able to recover these credits, the youth could graduate on time with his peer group. And the very best story of all, and I know I've been beating this one, happened back in October. We had a 7-year-old boy in 3 foster homes in 6 months. His volunteer went to the newest foster home. The foster mom went to the bedroom to get the young man, and when he came out and saw his CASA volunteer, his face completely lit up. "Thank you." And he said, "You found me." So that is what a CASA volunteer does. We thank you for the funding. We are asking for a $500,000 increase this year, and we will be using that funding to continue to open new programs, serve more children, and support existing programming. Thank you.
Thank you, Patty. Any questions? Rep. Steele.
Thank you. Real quick, my sister was a CASA parent in LA. So her only question was the communication with the child after they went back into the home, and that she had 0 contact with them. And that was kind of a sad story too, the help that they had offered as a volunteer. So I'm hoping that you allow that in Michigan. I don't know if you do or not.
We absolutely do, and that is really up to the child because we represent a pretty bad time in a child's life. So we allow the child to choose. I was assigned a case about 15 years ago, and I'm still in contact with the children. Any other questions? No? Thank you
Seeing
very
none,
much.
thank you, Patty. Thank you
Yes.
so much for your work. Next, we'll call up Jamie Ayers, Director of Victim Services, and Jeff Kapuscinski, Chief External Relations Officer of Common Ground.
Good morning. Thank you, Madam Chair and the rest of the committee. I currently oversee Michigan's 2 resiliency centers. One is in Oxford following their mass violence incident in November of 2021, and the second is in East Lansing following their mass violence incident that occurred on the MSU campus of February of last year. When we started at the Oxford Resiliency Center, we quickly realized there was a serious gap in mental health services. There were not enough clinicians to meet the demand in Oxford and even Oakland County. Finding a therapist was challenging. Finding a trauma-trained therapist was even harder. And when you could find a therapist, you were often faced with a wait list that was several months long. As Common Ground was building the behavioral health urgent care, we quickly realized how helpful it was to have quick access to quality mental health services provided by highly trained individuals. And that wasn't just for Oxford, but across the entire state. As we opened the United Resiliency Center in East Lansing in February of this year, we know providing this vital service would be especially important to the Spartan and surrounding communities. Even though our short-term federal grant covers the directly impacted individuals, we know that the ripple effects from these tragedies spread far and wide. It's also important to make sure that we could continue to provide mental health services through the behavioral health platform to the students who are heading home for the summer in just a few short weeks. Imagine your loved one or someone you care about has just experienced a traumatic event, a mental health crisis, or just needed extra support. And imagine how comforting it can be to pick up the phone and be connected to a highly trained clinician within minutes.
Okay.
And imagine if we could expand these low or no cost services across the state and into the communities that you represent. The behavioral health urgent care removes geographical and financial barriers so that individuals 12 and up can receive quality care. Common Ground kindly requests a $1.7 million investment over 2 years to support more individuals across the state by hiring more clinicians and providing access to mental health services virtually 24 hours a day, 7 days a week. Common Ground remains committed to providing services across the state and serving those who need all levels of support. Every day, I have the privilege to see the firsthand benefits of walking alongside high schoolers, college students, teachers, first responders, and community members who need a listening ear and someone who's available immediately. And this funding will allow us to continue to do this important work. And with that, I'm going to turn it over to Jeff.
Thank you, Jamie. I think you said it very well. I would only reiterate that Common Ground has been doing this for more than 50 years in the state of Michigan. The state of Michigan has placed their confidence in Common Ground to provide and operate these resiliency centers, as well as the 988 crisis line. So we stand at the ready to provide this service statewide and are ready to take your questions. Thank you for your time this morning.
Thank you for your testimony. Any questions from Rep. Steele?
Quick, I promise. My neighboring community is Orion, so I lived in Oxford 20 years, and I appreciate the work that you have done in Oxford. And you have just opened something in Lansing as well, too, so I'm familiar what this does to a community, but with the tragedy that happened a couple years ago. But my question is, what is the sustainability after this one-time funding? Because I'd like to see this program last longer other than this one-time grant. Thank you.
Well, thank you. That's a great question. We fundraised an equal amount of money to get this program up and running. Those dollars were dedicated to setting up the platform and operating the technology that we need to run this service on a statewide basis. Our plan going forward is that this program needs people to visit in order to sustain itself. We now have contracts in place with several commercial insurance companies, including Blue Cross Blue Shield, as well as Health Alliance Plan, to provide this service for their members. They were particularly excited that this service will be available statewide, as in some of the outlying areas of the state, the services are far and few between. So this presents a great opportunity to provide mental health care for folks in those communities, as well as some of the other areas that we support.
Rep. Price.
Thank you, Chair, and thank you for coming in today. Could you talk a little bit about how many people have benefited from your program and what you anticipate the need that you'll be able to fill with the expansion?
To date, we've served almost 2,500 people in just over a year's time. We expect that number to grow geometrically as people get more comfortable with this technology and the word gets out about this service being available to them, particularly the commercially insured individuals.
Okay, thank you so much for being with us. Next, we invite Jeff Roberts and Kristen Roberts of the Miles Jeffrey Roberts Foundation. And you just need to turn the button on the mic there in front of you.
Oops. Good morning. It is an honor to speak to you today. My name is Kristen Roberts, and I'm the co-founder and president of the Miles Jeffrey Roberts Foundation. Our son, Miles, died by suicide on May 29, 2017, his freshman year at Ann Arbor Skyline High School at the age of 15. Miles was an amazing kid. He was the life of the party, and he filled up the room. He connected with people of all ages. He loved to protect and counsel his peers. He thrived playing many sports, but his favorite was hockey. He was not someone who seemed to be at high risk for suicide. He did struggle, though, with depression and anxiety during middle school, as did many of his peer group. He saw a therapist for a short time in 7th grade, but he didn't find it helpful. He gravitated to his friends for support, but often shouldered his emotional challenges on his own and really kept everything trapped inside. The transition to high school was really hard for Miles. He was impulsive and exhibiting risk behaviors both in school and at home. Despite his struggles, though, sports was always positive, providing structure and support from his teammate and coaches. Miles' death by suicide was devastating to our family and community, and the aftermath has ripple effects that will never leave those affected by this type of loss. His brothers were 7, 11, and 16 when he died. As parents, we understood immediately that we needed to be honest about his death and fight the stigma of mental health and suicide loss. In 2019, we established MJRF in honor of Miles' life. Our mission is to empower the youth athletic community and promote mental well-being and suicide prevention. We raise money through community fundraiser events, individual and family foundation donations, student-initiated fundraisers, and a 3-year millage grant. We have raised over $350,000 to date. In 2022, we began the MJRF Champions Pilot at Skyline High School. This program is a transformative approach for engaging youth athletes through trusted adults and mental health professionals. The CHAMPS program provides support, resources, and education for mental well-being. To date, our 3 champions have conducted 15 presentations to 252 athletes. 3 more presentations will occur this spring, reaching another 120 athletes. I'm most proud to share that 6 of these 252 athletes requested individual follow-ups, and our embedded champion, a school psychologist at Skyline, then supported their connection to mental health services. We are working with Ann Arbor Pioneer High School as our next MJRF Champions program starting this fall 2024. Our continued community fundraising, in addition to being the 2024 and 2025 recipient of the Ray and Mary Knight Foundation, will support this program expansion. MJRF, though, is seeking funding from this committee to help us drive implementation of the CHAMPS program to other Michigan high schools in Ann Arbor and beyond. I hope that these success metrics will convince you of MJRF's potential for greater Michigan high school outreach we can make with our requested $500,000 in state funding. Thank you for your time and your service.
Hello and good morning, Madam Chairman and Committee. Thank you for the chance to speak with you today. My name is Jeff Roberts, and I am co-founder of the Miles Jeffrey Roberts Foundation. As indicated, the MJRF Foundation was established to advance youth mental health, suicide prevention through evidence-based programming and policies. The journey that brings me here today started with a phone call from the Michigan State Police at 6 a.m. on Sunday, May 28th, 2017. The officer on the phone asked me if I had a son named Miles Roberts. I confirmed I did. They then asked me if I knew where he was. My heart sank as I responded that I believed he was in his bed sleeping. The officer informed me that Miles had been injured and was on his way to Mott Children's Hospital. In 2017, in Michigan, there were 198 deaths by suicide for people ages 15 to 24. My son was one of those deaths. That number has not changed in 2022. Again, 184 at the same rate. The news of Miles' death shocked the community, and Kristen and I felt the urge to be honest about the cause of death with the school and the students in an effort to fight the stigma of mental health and suicide loss. The next school day, we were compelled to meet with school administrators, his football team and his hockey team, to share a message of community and an appreciation of Miles' life. Our family works hard to understand and accept Miles' suicide. It was immediately evident that this is not a life event that one family or an individual can get through alone. We participate in suicide awareness prevention events and programs. We meet and listen to many psychologists and experts in the area of suicide prevention and mental well-being. And there was one perspective that resonated the strongest: the ability to treat mental health the same way as we currently treat physical health. Mental health has historically been marginalized in part due to the stigma attached with seeking help from mental health issues, and the feelings of shame for not being mentally tough contribute to the culture of silence. This is not true when it comes to physical health. We can depend on ourselves and those around us to support getting the right treatment to address our signs and symptoms without fear of feeling shame or being represented as weak. With mental health, there are still deeply ingrained social and cultural barriers for asking and receiving help. These barriers must be removed. We believe it is time to prioritize the education and training and exercising of our minds like we do our bodies. And due to the generous funding from our community and at no cost to the high school, we were able to implement the MJRF CHAMPS program, an opportunity to train youth athletes on mental health and suicide prevention. The program engages youth athletes and provides them the tools to identify their own feelings, see the signs in their teammates, and understand resources available to them. The program currently focuses on Level 1 mental health awareness topics with focus on illness, wellness continuum, as well as depression and anxiety. To date, 100% of the 252 student athletes have identified that they feel more confident discussing mental health, identifying teammates that might struggle, accessing mental health resources, and seeking out mental health for a personal problem. The goal is to educate and train personnel in the youth athletic community in the area of mental health and well-being in an effort to reduce the number of deaths by suicide to zero. Thank you very much for your time.
Thank you so much for being here today. Very sorry for your loss, but thank you for all the work you're doing to make sure that this happens to fewer families in the state of Michigan. Representative Braybeck does have a question. She is on video.
Thank you so much, Chair. I appreciate it. Mr. and Mrs. Roberts, thank you so much for being here. And Miles is a fantastic kid, and he would be so proud of all that you are doing now for his legacy. My question is about and you alluded to this a little bit, but I know right now you're working with student athletes, particularly in Ann Arbor, and hoping to spread that out. Can you speak a little bit to what you're hoping to do with this appropriation in terms of reaching not only other high school student athletes throughout the state, but also potentially reaching other students in other clubs and other after-school activities as well?
Yeah, thank you. Certainly this program is transferable. Mental health, physical health alignment doesn't matter to be athletically inclined or to be playing a sport. And so what we've attempted to do is hone in on the athletic community for a couple of reasons. One is they put themselves in stress-bearing conditions through physical participation as well as competition. So we wanted to help demonstrate that this program was capable of moving their needle on the mental health continuum. And certainly as we are moving through our initial program at Skyline, we were already engaging it with other clubs and communities that are not in the athletic program to get the same access to these champs. However, as a result of needing to narrow down the community that we could focus on, we are structured in the athletic community. That's where Miles thrived. And the appropriation would allow us to quickly expand into the other high schools in Washtenaw County. And certainly once the program is expanded into those high schools, the ability to move out from the athletic community into the other communities, whether that's the arts, whether those are after-school communities, is going to be one that we believe will be very transferable and easily recognized.
Thank you. I really appreciate it. I would just add that obviously the Roberts shared this, are from Ann Arbor, and our two kiddos who are 17 and 14 attend the same high school that Miles did. And in fact, one of our kids was lucky enough to be able to be a part of the CHAMPS program. And I can't tell you how much it helped in terms of her, she was talking all about her experience from the presentation, and we had so many subsequent conversations about mental health and what she learned and what she can recognize in other people. It made a huge difference. And in our family, as a lot of you know, we talk about mental health. and try to reduce stigma as much as we can. And even in a household where that is common, the presentation and the connections that our kiddo was able to make just enhance that safety network that we need to have for all of our kids even more. And so I'm so grateful both for what you're doing for everyone in our community, but also for the impact that it's had on our family as well. Thank you, Chair. I really appreciate it.
Thank you, Rep. Braybeck. Any other questions? Again, thank you for being with us today.
Thank you.
Next, we'll call up James Gallant of Marquette County Suicide Prevention Coalition.
Hello.
James, we can't really hear you at the moment.
Hello?
Oh, there we go.
Oh, okay. Can you? Okay, so are you hearing me now?
Yes, we can hear you. Go ahead.
Oh, okay. Yeah. Thank you very much. My name is James Gallant with Marquette County Suicide Prevention Coalition, and I appreciate the opportunity here to speak about the appropriations for the mental health services. And it's like the people were already testifying here, like the Common Ground folks and the others, is that what I'm working on is to more clarify what it means to provide mental health care in Michigan, from the system of care, the entire system of care, and what we're looking at is we're told that there's no real definition of comprehensive mental health services, what that actually means under the law, and we're hoping that you would consider including that in these laws, because I was received a response from Elizabeth Hertel, the director of the Health and Human Services in Michigan, for what task force. We came together and asked her, sent her a letter and said, hey, you're appropriating these hundreds of millions of dollars. The governor keeps saying comprehensive mental health services. And then there's like the E3 program in the schools, there's behavioral health.
Mr. Gallant, I'm so sorry. We cannot hear you again.
And they all say comprehensive mental health services. And the director, Hertel, stated to us in writing, and I'm working on.
Mr. Gallant, I don't know if you can hear me.
And I will here shortly. The letters from the state saying that the operational definition of comprehensive mental health services, starting in budget year.
Mr. Gallant, we're going to cut you off and come back and try to have you come back because we cannot hear what you're saying.
So the same code that we expect from. Oh, okay. How's that?
Yes, so sorry about that. We could not hear you at all. So we'll come back to you in a few minutes. We'll try again. So next we'll call up Caitlin Lamy, Bobby Dorigo Jones, and Jenny Pollock of the Michigan Association of United Ways and 211.
Thank you for the opportunity to speak on the DHHS budget and the funding requests that we have. I'm Jenny Pollock. I'm the Executive Director for Michigan 211. 211 has been a critical and reliable service to connect people in need with support in the community simply through dialing 211 24/7, 365 days a year, and now through text and chat and our database online for someone to search for themselves. 211 was created out of local and community investment has been available in every county of Michigan since 2017. We are grateful for the recent support of the state of Michigan. We're a robust statewide network including 7 regional 211 centers regulated by the Public Service Commission and accredited nationally by Inform USA. Last year, we fielded over 400,000 requests from Michiganders in need, and we published aggregate anonymous data to help decision makers be aware of needs, referrals, and unmet needs in their communities. One of the first calls that I took was from an older gentleman, recently widowed and unfamiliar with navigating life, let alone through grief and in financial need. He vulnerably shared with me he didn't invite his family over anymore because he was embarrassed of his limited resources. I believe being a voice on the phone helped him let his guard down. We built rapport and realized there was a food pantry literally in his backyard. Over time, the relationship grew, and he trusted 211 to accept additional help, eventually receiving monthly benefits that he qualified for and restored his relationship with his family. We know individuals are also comfortable searching for help on their own, and communities are now strengthening referral pathways through community information exchange. While needs remain largely the same, housing, utility assistance, food, the situations people are navigating within and how resources are accessed are changing. 211 has grown as a partner in disasters as well as helping with day-to-day needs, helping emergency managers respond to natural disasters like flooding and fires, and others like the water crisis or COVID-19 pandemic. As a result of the state's funding, investment, and support, we've partnered now with several state of Michigan and statewide community-based programs such as My Bridges, MyCal, Michigan Veterans Affairs Agency, MISHDA, and MSU Kinship Care Resource Center. The $2.95 million we received last year allowed for our statewide network to use the same technology platforms, which allows us to aggregate reporting, balance call volume, and stand up the COVID-19 hotline very quickly. The CIE infrastructure funding is transforming our ability to connect people in need and community organizations electronically with secure, interoperable platforms. We have over 15 partnerships live or in process made possible by this investment. The governor has recommended $1 million increase this year, and we appreciate this increase and want to build upon it. Our current request is to increase our current state funding by $7 million to build upon this work in pursuit of our vision.
Good morning. My name is Caitlin Lammy. I'm the interim president and CEO at the Michigan Association of United Ways. Local United Ways serve as a critical role in their communities as both funders and conveners of essential community services. But our ALICE and our 211 data tells us that there are hundreds of thousands of people across the state of Michigan who are struggling to make ends meet but don't know where to turn when they need help. 211 is that statewide service. It's the most efficient and effective tool that's available to every citizen in Michigan, and it leverages the investments that we make here at the state of Michigan, as well as the nonprofit sector and other folks who contribute to those critical resources across the state. It's also the essential vehicle to make sure that there's no wrong door approach for citizens who are looking for services across Michigan. This more substantial increase in 211 is also going to help us navigate needs of citizens that are more complex. It's going to help us build upon community information exchange and social navigation, which are really the forward future of delivering high-quality health and human services to our most vulnerable populations. I want to thank you all very much for your commitment to Michigan families and for your strong support of Michigan 211 and investing in a powerful tool that's going to help serve our most vulnerable and help Michigan families thrive. Thank you.
Thank you so much for being here today. Do we have any questions from the committee? Rep. Price.
Thank you, Chair Morse. Thank you for coming in today. Could you talk a little bit about the follow-through with people who reach out and how some of the regions and services are different and what we can learn from the ones that provide the most follow-through?
Sure, thank you for the question. 211 follows up with individuals after they've reached out to us, and it's then that we realize whether they were able to get connected with a resource. We document that need and publish that information. We're hopeful with community information exchange and kind of more tightly connecting community providers that that's going to be available more real time for a broader population for folks that are seeking support.
One follow-up question, thank you. If you reach out and the person didn't receive the support that they need, what's the next step? Tell me a little bit more about that.
Sure. So a continued conversation, right? Really to probe, to understand what the barrier was and to articulate that to decision makers as applicable, and to advocate, but also to kind of be a sounding board to help someone realize their natural supports and maybe kind of talk through other resources, other strategies to meet their need.
We also have a question from Rep. Hood, who's joining us virtually. Rep. Hood, go ahead.
Thank you, Chairwoman Morse. I'm curious, in doing some work around this request and understanding it better, it became clear to me that there were several departments across the state's portfolio of services that on support, but other events are significantly supported by 211 services.
Rep. Hood, can you repeat that because we lost you for a few seconds?
I'm sorry. It's become clear to me in doing some research around this request that 211 and the United Way serve multiple departments across the state. Can you highlight for us what those departments are and, beyond the scope of the DHHS budget?
Sure. So there's several programs within the Department of Health and Human Services, but additionally, with the Michigan Veterans Affairs Agency, with MyCal, MISHDA, those are the, and also the Secretary of State with the Road to Restoration clinics.
Great. And are there similar requests in those budgets to support 211?
Our current request is through the Department of Health and Human Services budget.
Thank you.
Thanks, Rep. Hood. Okay, thank you for joining us. We'll move on to Sean Skane, Director of Utilities, and Shayla Zimmerman, Associate Director of Special Projects, United Way for Southeastern Michigan.
Thank you. Good morning, Chair Morse and members of the subcommittee. Thank you for the opportunity to speak with you today about water affordability in Michigan. My name is Sean Skane. I'm the Director of Utility Services at United Way for Southeastern Michigan. For those of you who are not familiar, we are an impact-focused, community-based nonprofit with a broad portfolio of work and investments across Wayne, Oakland, Macomb, and Washtenaw counties, including a variety of direct service programs and over 100 funded partner organizations. We seek to strengthen our community by improving household stability and ensuring that every child has what they need to thrive. As of January 2023, our United Way has been the administrator of the Water Residential Assistance Program through the Great Lakes Water Authority for Oakland County. We are committed to providing timely, sustainable solutions for our clients and our partners. Since we have been administering the Water Assistance Program here in Oakland County, approximately 936 households have been enrolled in WRAP. Through WRAP enrollment, clients are enrolled into an income-based water assistance plan that allows a payment towards past due arrears while also providing ongoing assistance through a monthly bill credit to ensure affordability. Since we have started administering this program in Oakland County, we have seen demand for these services increase as clients become more aware of them. The greater Southeast Michigan region is home to over 4 million people. 39% of them who fall below the ALICE threshold, which is a widely used relative poverty measure based on an individual's or family's ability to fund a basic, no-frills monthly survival budget. That's more than 1 in 3 households who struggle to afford basic needs, including water within their home. When people cannot afford to pay, they face a potential loss of water services, added economic hardship, and grave risks to both individual and community health. Our team hears these calls every day from residents in Oakland County. We hear the anxieties, worries, and exhaustion of families who are desperate to find assistance that can ensure one of our most essential needs, water, stays available to them. We must ensure that funding is available for vulnerable individuals and families who may not have the ability to pay and are facing a water shutoff. United Way for Southeastern Michigan also administers the 211 community helpline for our region. This is an essential part of our human service infrastructure, which provides information and referrals from professional community care advocates who can connect those in need to nearby support and resources. The service is available throughout the entire state, meaning someone can dial 211 from anywhere in Michigan and receive support 24 hours a day and 7 days a week. Every year, our region's 211 alone receives approximately 195,000 calls from individuals needing assistance. The last year, approximately 8,400 total referrals were made for water payment assistance. We see this need for water assistance continue to grow year over year. Last year, the legislature appropriated $60 million to help pay for water bills. It was $25 million in the January 2023 supplemental and $35 million in the fiscal year 2024 budget. We want to thank you for taking this step and for acknowledging the unaffordable water bills that threaten access to water for many Michiganders. We respectfully request level funding of $60 million for fiscal year 2025 to help ensure that water remains on in vulnerable households throughout the state. As others have mentioned, we do not anticipate requesting ongoing appropriations once the water affordability legislation passes, which we hope it will with your support. Thank you again for the opportunity to speak with you today and for your continued leadership in protecting those who are unable to afford safe and clean drinking water. If you have any questions, please let me know. But for now, I would like to hand it over to my colleague, Shayla Zimmerman.
Good morning, Chair Morse and members of the subcommittee. My name is Shayla Zimmerman. I'm the Associate Director of Special Projects in the Community Impact Department at United Way for Southeastern Michigan, and I'm currently a resident of Detroit in Wayne County. I've had the honor of managing various projects at United Way for Southeastern Michigan for 2.5 years. During this time, I've loved working in collaboration with our utilities team to build out United Way's water assistance program for Oakland County. It has been a really rewarding and full circle experience for me. I've had the opportunity to truly advocate for under-resourced communities, build a program that is culturally sensitive and accessible, and do everything in my power to keep families' water from being shut off. Something you might not see when you look at me is that I grew up in poverty and mostly living with my grandparents on the east side of Detroit. But I moved around a lot almost every year with my divorced young parents. Growing up, my mom worked in the medical field and had a really hard time keeping up with raising her 4 kids and holding down a job. And we experienced a lot of financial hardship. Our electricity was shut off and we were evicted from homes and apartments more times than I can count. And I vividly remember the day that a water department worker came to our door to shut off our water. I was about 16 years old at the time and was watching my 2-year-old brother and my 2 sisters who were around 10 years old. It was hot, it was summer, and our power was already shut off. I answered the door with my brother on my hip and to a man in overalls holding a really large wrench. And he said, "I'm here to shut your water off. Are your parents around?" I explained that I didn't know anything about this and that my mom was at work. And I was watching my younger siblings. I watched him through the window as he started to dig a really large hole in the front yard, exposing a pipe to turn the water off. And then he went into his van and he spent a good amount of time talking on the phone. Some time had passed and he came back to my door and handed me a piece of paper with a phone number on it and said, "I'm not going to shut your water off today. Give your mom this number and tell her we can help." I thanked him and he left without shutting our water off that day. At that time, I was too young to understand the weight of his actions, and now I reflect on his kindness and advocacy. He probably looked into mine and my younger siblings' eyes and knew he couldn't go through with this. He probably risked his own job to advocate for us, and he decided that he would choose to be a good neighbor and not someone that followed directions. He probably knew that what it meant for us young kids not to have water. He probably knew our health would be at risk. We wouldn't be able to bathe, brush our teeth, or drink water. And I didn't know his name, but now that I work to advocate to keep people's water on and ensure our client teams are supported, I honor him and his choice in my work every day. Thank you again for this opportunity to share my personal testimony and why water is important to all of us.
Thank you so much for sharing your personal story. Do we have any questions? No questions. Thank you both for joining us today. Next, we have Bridget Clark Whitney, President and founding CEO of Kids Food Basket. I need you to turn on the mic there. Yep. Yes.
There we go. Good morning, everyone. Thanks so much for having me today. Such great work being presented. It's an honor to be here and listen to all of this. And thank you to all of you for your service and great questions. It makes me proud to be a Michigander, right? When you hear all this great work and the people that are passionate about it. I'm Bridget Clark-Whitney. I'm the president and founding CEO of Kids Food Basket. We are a food access organization in West Michigan. We do healthy food access for children and families each and every weekday throughout the school year and throughout the summer. We also have 2 10-acre organic farms where we're growing healthy food and teaching kids where food comes from, why it's important, how to produce produce, how to grow produce. We also have nutrition education. We go into classrooms in 4 different counties in West Michigan, teaching children an extensive lesson plan around growing healthy food, also about phytonutrients, different fruits and vegetables, and why they're important for their bodies. This work has been my life for the past 21 years. I've been the president and founding CEO and going on my 22nd year. And in 22 years, I can tell you we have never had as many requests for services as we've had this year. Inflation has affected all of us. And that's certainly true for our families who were already struggling prior to the pandemic, our ALICE families, our asset-limited families, who are really experiencing more difficulty in purchasing healthy, fresh food. And so we are receiving more requests for services on a daily basis. We currently have about 42 schools that are still on our waiting list for services. Kids Food Basket is 92% philanthropically funded. We really appreciate the support that we've had in the past from MDHHS. From this past year, we had a $1.5 million support from MDHHS. We're asking for an increase this year to $2 million. To help extend our programming scale to pick up some of those schools that are on our waiting list, but also to increase the amount of schools that are receiving the nutrition education programming. The data continues to prove that when kids are receiving healthy, nourishing food consistently, there's better grades in the classroom, there's less truancy, less sicknesses, and significantly less behavioral issues. One school reported in the very first year of Kids Food Basket serving this school, they had a 21% increase in their MAP scores. Another school reported in Kids Food Basket's first year in their school, they had an 86% decrease in suspensions at the end of the day. Why? Because children who are often living in poverty, living with toxic stress, unsure where their basic resources, basic needs are going to be met. And so at the end of the day, receiving healthy food every day decreased those significant behavioral issues. And so each and every day, we're providing this healthy food through the help of volunteers. We average about 250 volunteers a day. We're providing 10,000 healthy meals each day, 2 10-acre farms, and providing nutrition education to about 250 students each week throughout the school year and throughout the summer. Again, we're super grateful for the support that we've received from the state of Michigan, and again, hoping that you will consider an increase to $2 million this year so that we can respond to these ever-growing increases due to inflation. Thanks so much.
Thank you. Do you have any questions? Rep. Steele.
Just real quick, I know that we provided free lunch and breakfast for the state of Michigan students, public schools only, I think, but I just wanted to know how you integrate the fresh food into that program and how many, which counties did you provide?
Yes, thank you. We're in Kent County, Muskegon County, Ottawa County, and Allegan County on the west side of the state. So we have both school districts that are high poverty in urban areas as well as high poverty in rural areas. Thank you for asking that question. We did predict that there would be a decrease in requests for services this year because of universal meals. Unfortunately, it's been the opposite. There's a few reasons for that. One, the quality of meal that we're providing is high. The nutrition, the caloric intake and the nutrition density is really good. And so kids are receiving healthy fresh fruits and vegetables, which they're often not receiving through those school lunches. One survey in May showed 86% of teachers said without Kids Food Basket, the children in their classroom would not have access to fresh fruits and vegetables. Also, breakfast in the classroom is unfortunately really sparely used, and it's because the breakfast oftentimes, most school districts are providing breakfast before the buses arrive. So breakfast is available, but very few kids are actually utilizing that service because the buses haven't arrived yet. Once the buses arrive and the bell rings, the breakfast program isn't available any longer. So unfortunately, whereas that's available, it's not being widely used. We are advocating for school districts to take on a breakfast after the bell program where breakfast can actually happen in the classroom. So we're working with our districts on that. Muskegon Public has taken that on, providing breakfast in the classroom, which is really been very beneficial. Also, in many of our school districts, breakfast is like Pop-Tarts and orange juice, right? So starting the day with that high sugar intake isn't what our kids need first thing in the morning. And so we're also advocating for a higher protein breakfast. We're also advocating at a federal level for more funding in CACFP programming, which would provide for higher density, nutrition density after school meals for kids in Michigan. Right now, we're utilizing that at less than 2% of available dollars through the CACFP program in Michigan.
So do you integrate with the lunches? I didn't get that answer.
Yeah, so we're working with our school districts to ensure that our kids are getting the nutrition that they need, but most of the time our school districts' lunches have the nutrition quality is less than the meals that we're providing. So we're working with our nutrition services in each of our districts, specifically in the breakfast area.
Okay, thank you so much for being with us this morning. Thank you for your work.
Thanks, Representative. Thanks, Subcommittee.
Okay. And we're going to return to James Gallant, who had technical issues. James, go ahead.
Okay, can you hear me?
Barely.
Barely. Okay, how's that? Sir, I'm on the digital divide here. Okay. It's what we were getting to on before, sorry, and is about the definition of comprehensive mental health services. All of these services are meant to be, and it's even in, like I was talking about, the E3 program for the schools. The first sentence says, some funding will be used for comprehensive mental health services. And what the director was talking about in the letter, and I'll send a letter to you, is that in the Michigan Mental Health Code, there's a MCL 330.1712. All mental health service providers will provide an individualized written plan of services. And that plan will address 9 issues in a person's life: food, shelter, clothing, medical care, mental health care, and also the needs for legal services. And this is missing from the entire system of care. And those services are available already in the community. The needs for legal services for about 63% of youth suicides are children from fatherless homes, and they're affected by the family court. So every court in the state is required to maintain a make-up parenting time policy in which the children can receive make-up parenting time and get those needs for legal services addressed. All we need is for the school to refer the children back to the court for enforcement of their court orders. And this is reimbursable under insurance and Medicaid, which I verified through the Department of Education. Is all they have to do is sign up to be a Medicaid provider. It's required under the Mental Health Code. So therefore, it can be provided the funding for, you'll get Medicaid funding for that. And for all other, Blue Cross Blue Shield would cover this because it's in the Mental Health Code and they're in the services. So I'm hoping that you will ensure that it's all of the parameters in a person's life, that, everything got nothing to do with age, gender, or all of that. The individualized written plan of services is food, shelter, clothing, medical care. This is one of the basic things needs of a human being. And then it gets splits into your age, your male, female, whatever it is. And so we need to make sure that the people are actually being provided with the comprehensiveness that's required. And that is the needs for legal services, because this, we can hear the testimony of the people. And I started this in Marquette back 10 years ago in 2013. And back then it was Do It for Daniel. And now we have Miles, and now we have others, and it just doesn't stop. And the reason is because I believe that the people in the mental health services are being neglected under the Mental Health Code, because it says neglect is denying them any right they have under the Mental Health Code. So if you're not addressing needs for legal services, that's neglect. That's neglect of a mental health patient. And these people are sent on their way until it becomes a problem again, and then they're back. It's a revolving door. And we need to get this part about the legal services and the divorce and what the effects of that are on the families. And but I will be providing a report shortly, pulling together with some information, and I'm with the Upper Peninsula Wellness Coalition.
Okay,
And,
Mr. Gallant, your time is up. Thank you so much.
For your service, and hopefully we can get ahead of this suicide thing soon. And thank you very much.
Thank you. Thank you for being with us. Any questions from the committee? No questions. Thank you. Moving on to Nicole White, co-founder and director of Birth Detroit and State of Birth Justice. And if your colleagues are going to speak, just make sure you state your name for the record. Thank you.
Good morning, Chair Morris and the committee. Appreciate your time. My name is Nicole White, and I am joined today by Leslie Welch and Cassie Jones McBride. We represent Michigan State of Birth Justice and Birth Detroit. Birth Detroit is the first of its kind Black-led birth center in the city of Detroit, working to improve outcomes for Black mothers. And the State of Birth Justice is a community coalition coming together to work towards decreasing the inequities that occur across the state, particularly in rural and urban areas. We all want healthy families. We all want birthing families to be safe in the state of Michigan. But Michigan is experiencing a crisis with an access to maternal health, and also perinatal health outcomes for people of color are abhorrent. In Michigan, 30% of counties are considered maternal health deserts with literally zero access to obstetric care. We know that the United States has the highest rate of maternal mortality of any developed country. And the maternal mortality rate is higher than it has been in decades. And the United States is also the only developed country, to see maternal mortality rates rising. Michigan has invested millions of dollars in recent years with little improvements to racial disparities. Black women are still 4 to 5 times more likely to die than their white counterparts, and Black infants are 3 to 4 times more likely to die than their white counterparts. Good news is, midwives are proven to reduce racial disparities. More good news, midwives also save money. Studies show that if midwives led 20% of births by 2027, we would save over $4 billion. And over $1 billion of that would come to Medicaid savings. And that's only increasing by 20%. We see a lot of evidence that most countries have midwives serving 80% of their births. So can you imagine that staggering number? Midwives are safe. The World Health Organization says that it's the #1 way to combat maternal mortality worldwide. In Michigan, midwives are explicitly excluded, and policies have been implemented that block women's access to midwifery care. Our Medicaid state plan does not cover community-based midwifery. And we're only one of 6 states that explicitly exclude mandatory coverage of home birth, and we're the only state that explicitly excludes mandatory coverage of birth centers in our ACA required benchmark plan. So we have 3 asks today. One is to require reimbursement of licensed midwives and certified nurse midwives in Michigan's Medicaid program. Another is to require Medicaid reimbursement of birth centers, understanding that the provision would only take place if policy is signed into law. And I wanted to name today in front of you that a birth center bill is going to be hopefully introduced this week by one of your esteemed colleagues. So that is great news. And even though we're putting the cart a little bit before the horse today, we just didn't want to didn't want to miss this opportunity to let you all know that we really are hoping that Medicaid reimbursement will cover all midwives in all settings. We also know that this committee has heard about the incredible opportunity of the TEMA grant, which is the CMS grant that is talking about integrating midwives. It's covering birth centers. It's talking about implementing tech support to reimburse CPMs and CNMs into all settings. So we really hope and encourage the department to do that, and just wanted to name that. Thank you so much for your time, and we'd love to have any questions.
Brett Price.
Thank you for being here today. And as a representative for Northwest Detroit, I'm very grateful for the work that you're doing in that community. Could you share a little bit more about how birth centers and supporting community-based midwifery can help close the gap, the incredible gap that we have for women of color, and the outcomes that they currently experience in the birthing and postnatal process?
Culturally congruent care is proven to work. And we know that midwives are proven to reduce racial disparities, partly because we take care of the whole person, and we do more extensive prenatal and postpartum care, and we also let joy into the room. I hope next time we're here in front of you talking about maternal health, we can talk to you about all the incredible stories that we get to see of thriving Black families, thriving families of color. Leslie,
My name is Leslie Welch. I'm a co-founder of Birth Detroit and president of the board. And I would add to that inherent in the midwifery model of care is an assessment of the needs of the whole family, so physically, emotionally, and socially. I would offer as well, as Nicole indicated, that culturally congruent care and culturally reverent care, which is different because it honors and affirms the culture of families, and that it makes a tremendous difference for families to give birth in a birth center designed in response to the hopes and dreams and needs of the community. It calls home, and with midwives who are from the community. And that is what we are aiming to provide at Birth Detroit, and that we hope every community can have access to one day in Michigan.
Well, thank you so much for being here today. Appreciate the work.
Thank you.
Next, we'll have Deborah Pospich, Detroit Water and Sewerage Department, and Maggie Pallone of Public Sector Consultants.
Good morning, and we're actually going to switch order if you guys don't mind. Thank you. So I'm Maggie Pallone. I'm with Public Sector Consultants. We're a nonpartisan research and consulting firm. Thanks for having us here today. A whole bunch of folks are going to speak to the need for a water assistance program in the state. I just want to provide a little bit of information about the research that PSC has done over the last decade around water assistance and water affordability to hopefully set the stage for the rest of the folks to come up here and testify in front of you today. So just to maybe set the table a little bit here, water affordability is a unique issue across the nation in that it's the only the only utility that doesn't have a national program to support it, right? So you think about LIHEAP and even cell phones have a program. Water does not. So it's left to the individual water providers or up to states to figure out how to support water assistance and affordability in the state. Across the state, it's generally defined as anything more than 3% of your total household bill or your total household income would be considered unaffordable. So last year, PSC went about the work of trying to understand how affordable water is in the state, and we actually looked at 470 water utilities representing 70% of the state's population. And what we found is that the average water bill in the state, if you think about it, 3,000 gallons, so that's like 2.5 people in a house, is $63. And when we looked at how affordable that is across the whole state, we found that there's almost 400,000 households in the state that pay more than 3% of their household income towards water, their water and sewer bill. That's about 10% of the households in the state of Michigan, and it's actually in every county and every community. There was not one water utility that had no households that we considered having affordable water for. Those 400,000 households represent an annual gap in affordability of about $180 million across all water utilities in the state. If we think about what that would mean for the state or a federal program, it's an average gap payment of about $55 a month, ranging for those that are under 50% of the federal poverty level, so the extreme poor in our state, to just $17 for households that are between 150 and 200% of the FPL. So while our research shows that there's a significant number of households that are water burdened, I know that there's conversations happening amongst your colleagues about how to address that. In the absence of a federal program, I just want to end with this thought that really our water utilities are faced with limited options, right? They either have to decide to address water affordability or address clean, safe water. There's no other option for water utilities in our state. It comes from water rates. And so as we think about programs that can support that, not only is it supporting those 400,000 households that have water that's unaffordable today, but it also ensures that we have clean, safe water into the future. With that, I'm going to hand it over to Deb to talk more about water utilities.
Thank you, Maggie. Good morning, Honorable Chair Morse and the committee members. My name is Deborah Pospich. I'm here on behalf of the Detroit Water and Sewerage Department as one of the many water utilities in the state who support a $60 million appropriation to continue life-sustaining water bill assistance, while we also strive for a dedicated funding source through future state legislation. As many of you know, there have already been state appropriations for water, and I can unequivocally state those appropriations have had a significant positive impact on both the utilities and the residents. Most municipal water utilities are funded solely by revenues they collect from billings. When customers do not pay, state law allows us to foreclose a lien against the property, sue our clients, our customers, or turn off their water. Now, these remedies are strong incentives for the customer to pay if they can afford the bill. When these remedies fail, that uncollected revenue is placed on the books as the bad debt expense. And then even the foreclosure process does not recover 100% of the debt. So utilities raise rates the next year to compensate for those losses. So raising rates affects every customer and exacerbates the problem for our low-income customers. And when COVID struck, Governor Whitmer issued an executive order to restore water at all households. We went to 9,000 households in Detroit where water service had been discontinued at one time, and we found many families trying to survive without water service. And we know our experience is not unique. There are households in need across the state, according to studies by the University of Michigan and public sector consultants. The prior state appropriations allowed Detroit to stand up its own water affordability plan, where residents pay a capped rate of $18 a month based on their household income. We found if you give a low-income family a bill they can afford, they will pay. Our program helps 28,000 households maintain water service. This appropriation protects public health in two ways. Customers will not be at risk of shutoff, and utilities have the revenues required to meet operational and infrastructure needs to maintain their systems. Lastly, there has been bipartisan support in Michigan for decades to fund heating and cooling assistance programs. Humans cannot survive more than 3 days without water, and we need it for proper sanitation. We strongly contend this appropriation for water affordability should be deemed equally or even more vital than heating and cooling assistance. Thank you.
Thank you for your testimony. Rep. Steele has a question.
Thank you for your testimony. And maybe you could answer the question because you actually work for Detroit Water System. So I was in local government, and our water is in Orion, and we get it from Detroit, and we get our sewage from Oakland County. And I was a treasurer, so I was very aware of how much increase our bills were at the township level to be able to pass over through to the residents because of the infrastructure. And I keep on, as I hear these testimonies, keep thinking that the money that we give to the end user would be better off spent on the infrastructure to reduce the water and the sewage bills for the entire state, not just a select few. So $60 million, you put it in the infrastructure, because I understand that Detroit could use some upgrades in the infrastructure in the actual system in which they provide water for almost 5 million people in the Detroit area. So this way we would alleviate all the agencies and the middle guy, fix the infrastructure, bring down the water prices for everybody in the state, and everybody benefits from it because these are our tax dollars, and it would be giving it back to all the residents that provide tax dollars back into the infrastructure to reduce the rates. That's what I would advocate for, because I am on transportation and we need to worry about our infrastructure that affects the whole state. So my question is, how about the residents that live on well water? I am in Orion, although I am on a well, my well cost me $5,000. If I need a new well, how much of this $80 million or $60 million will fix my well or anybody north that is mostly on a well? So I'm distressed about this whole water affordability. Thank you.
Thank you for your question, Representative Steele. And I appreciate exactly what you're saying. For low-income households, the bill, despite investing $60 million in infrastructure across the state of Michigan, would never become low enough for them to be able to afford. And there are other mechanisms for funding infrastructure projects. There's the SRF funds, the loans, there's federal and state grants for infrastructure projects. So there is money there that we can access for infrastructure, and we use that as much as possible to keep rates low so we're not using ratepayer dollars. But there will always be a segment of the community that cannot afford their bill, and that is what this fund would be used for.
Well water too?
Well water is separate, and this appropriation is for water affordability for municipal water systems. Now, the legislation that's pending does have some provisions for well water. So that's kind of a different thing that's coming down the pike with the legislation.
Rep. Hood, joining us virtually, has a question.
Thank you. In addition to my role on the DHHS subcommittee, I also chair the Eagle budget, where, as we have discussed, and I believe you've been a part of the discussions as well, we have a fiscal cliff. I simply want to applaud you for continuing to come to the state legislature and address how important it is to invest in water infrastructure. I would like to thank Representative Steele for making that point as well. And it's important to know that the people of Michigan will need to come together to solve some significant problems on these issues. I feel incredibly burdened having to make a decision between what is more important: an individual's ability to pay and afford to drink water, or our choices to invest or disinvest in water infrastructure. And felt it was important that I join the discussion to highlight a couple of those points. Thank you.
Thank you, Rep. Hood. Seeing no further questions, thank you for being here today.
Thank you.
Next, we have Jim Nash, Oakland County Water Resources Commissioner.
Good morning. Thank you, Chair Morrison, and the members of the subcommittee for the opportunity to testify today. This is a very important issue around supporting water affordability efforts in the state. For background, I was first elected into the Oakland County Water Resources Commission in 2012. I've been over 12 years working on to make sure that we responsibly protect the water and health, the public health and safety by managing water systems. My office has 350 employees. A good chunk of them perform operations and maintenance for 22 local communities, large and small. We have water systems, all these water systems, just these part of what I do represents 175,000 citizens of Oakland County doing their water and sewer services. Our operations include deep understanding of the budgets, rates, the affordability issues, revenue needs of our operations. In addition, my office operates and maintains capital replacement projects. In fiscal 2022, we did $250 million worth of these in 76 maintenance projects. From the water utility perspective, there's several critical factors that you really need to consider when you're looking at the appropriations for 2025. First, for over a decade, public water providers have been able to do more with less. My office has amazing folks that look at this every day, and the most valuable for each investment dollar. We're always looking to make the most efficient and efficient ways of using our funding. But that doesn't go as far as it needs to, because we have things that are coming up that we'll be needing to spend money on. Just the lead and copper rule, the new federal lead and copper rule, demands that we take out all lines in 10 years. Now, in the city of Pontiac, that's going to be about $6 million a year for the next 10 years for these ratepayers. When you look at it, right now we're spending about $3.6 million a year in Pontiac for our capital improvement projects and all the work we have to do for that system, the old infrastructure. This $6 million will dramatically increase the rates for these folks. That is really going to hurt folks. Already, 37% of the citizens in Pontiac are already have their water unaffordable. This is something that we've got to recognize. This is a fairly large system. The second factor that we have to consider is utilities do not receive tax dollars. We don't get tax dollars. Everything we do has to be paid for by the ratepayers themselves. When we're doing this, the federal funding and the state funding has been shrinking year after year for decades now, and to the point where until very recently, we had very little outside revenue to come in to help low-income folks and just regular communities that aren't low income. So going forward, we need to make sure that we recognize that everything has to be done through rates. And if we're not doing that, that's going to be a long-term problem for our water systems to succeed. Our water industry is not immune from inflation. We're suffering from that as much as anything else. We've tried to hold back rates, but it can't be done forever. And in communities with smaller populations, the Charter Township of Royal Oak in Oakland County has only 2,500 people, less than 1,000 customers in the whole city. So when something hits them, when they have a water main replaced, something like that, everybody's rates go up dramatically. As of now.
Mr. Nash, I'm so sorry. Can you wrap up? Your 3 minutes is up. If you could wrap up your statement.
I'm sorry. So we want to make sure that this new system that we're working towards can make people be able to afford their water. And at the same time, we have to make sure that what we're doing in the past 2 fiscal years, we want to continue until we do have some sort of funding mechanism. So we're asking that you continue last year's funding of $60 million, and this year we have so many people that need help and so many systems without help for their ratepayers. Their systems are going to suffer too. So we're asking that you continue this $60 million that you've been doing in the last 2 years and really work towards this long-term, sustainable funded system that the legislation is seeking. So I really appreciate your listening to me, and I want to offer us as a strong system that can give you advice on how this will affect people in the long run. So thank you so much, and any questions you have.
Rep. Price, go ahead.
Thank you, Commissioner Nash. Thank you for your long service to Oakland County and for showing up today and giving us this perspective. Your advocacy for the continued support, is that just for Oakland County or will that serve the whole state? And could you tell us a little bit more about the more long-term sustainable solution that we will hope to see legislation on in the near future? Thank you.
You're muted, Mr. Nash.
Oh, okay, sorry. What we're asking for in this legislation is several things. This would allow us to be able to fund in a much broader context than we can with the RAP program from the Great Lakes Water Authority, because this would give us basically a $2 a month fee on every account that gets water and sewer services. This is modeled after the Michigan Energy Affordability Program, which has been successful for over 12 years. That would allow us to fund local governments who would then, low-income people in their utility would be able to request a subsidy towards their bills. So they would pay no more than 2 or 3% of their income, household income, on water. This would allow them to also have plumbing fixes in their homes when they have leaks. It's a major reason why people fall behind in their bills is a leak in their home. And this would allow us to have a much more set in stone process for turning off water and an ability to actually get that funding so we don't have to turn off that water. When we turn off people's water, it not only affects their home, but when they go out into the workforce, if they're interacting with people, they can spread diseases because they haven't had the sanitation at their own home. So this has an effect on both the ratepayers overall and beyond the low-income folks who would be eligible, because when you when a system carries millions of dollars from one year to the next in unpaid bills, they have to either raise rates or cut back on repair programs that are going to cost more in the long run. So this has an effect on both the low-income ratepayers, the regular ratepayers, and the system in general. And this is why we're trying to make this happen, because we can't keep going the way we are.
Rep. Hood has a question. Go ahead, Rep. Hood.
Thank you, Chairwoman. Thank you, Commissioner Nash. I'm curious how you would frame up a responsible discussion about revenue for water infrastructure in addition to revenue for bill assistance and affordability.
Certainly.
What is a sustainable solution there?
Absolutely, I understand. So we are right now we work hard to make sure that the folks that we work with, that we serve, get what they need. It's water and sewer services. So to do that, well, look at this. SEMCOG, Tennessee Michigan Council of Governments, estimates just for Southeast Michigan, which is mostly served by Great Lakes Water Authority, we need $2 billion a year for 20 years just to fix the systems we already have. That doesn't count the lead and copper rule. That doesn't count old, new regulations that are coming in. So if we're not fully funding this, if we're not doing the true cost of service in the long run, when we delay repairs, when we don't do the work we should be doing, down the road, you'll have failures. And if you have a failure, instead of $1 million to fix a project, you could have $5 million to fix that same area because it's an emergency. You have to bring in new people. So whenever we're doing this, we have to recognize that we're replacing old infrastructure, we're replacing lead lines, and we're serving the people as best we can. We have to protect the health and safety of our ratepayers, of our citizens, and the environment we all depend on, because we can't pollute our water. If we do that, people won't want to live here anymore. So we have to make sure we're doing these things in the proper way, and without having some kind of help more than we're getting from the Great Lakes Water Authority, we just can't serve very many people. Earlier, you heard that the Great Lakes Water Authority is serving 9,000 families out of 4 million people. That's not enough. We're not doing enough. Too many people are falling behind. Too many people too many of our systems are suffering because of that. And we have to make sure that we're doing this in a better way.
And we have a fiscal cliff to address the infrastructure funding side of this equation, correct?
Yes. So we need more ability to do this, and by having some communities have a really large amount. I mentioned 37% in Pontiac, 57% in Royal Oak Township. They have a real problem making sure they can pay for their infrastructure. But even communities that are much wealthier, have a much higher average income, still have people in that community who cannot afford their water. So those folks will still be helped by this. And again, when you're not getting the water and the sanitation you need, you're more likely to become ill. You're more likely to spread illness in a community. And this is what we have to recognize as legislators, that we serve the community better when everybody can afford their water. People don't want to just get free water. They want to pay for what they're getting. They just can't afford it where it is now. And we have to make sure we can do what we need to do. A system that is long-term, sustainably funded is the best answer. But in the meantime, we still need help getting folks back on track. If they have a leak and they suddenly have a $2,000 bill, what do people do? How do they get by that? We need to have these systems in a way that repair their plumbing and at the same time help them to get the help they need to pay their bill and not fall behind and drag down the entire community's utility.
Thank you.
Thank you so much for the question.
Okay, seeing no further questions, moving on to Matt D'Ambrosia from Vital Data Technology. Thank you for being with us.
Thank you, Chair Morse and members of the MDHHS House Appropriations Subcommittee. Thank you for allowing me the opportunity to address the committee today. I'm Matt D'Ambrosia. I'm the President and CEO of Vital Data Technology. Our company has been delivering technology solutions that drive timely sharing of critical health information since 2005. We've been using artificial intelligence in our solutions for almost 7 years. Currently, we have the privilege of working with entities that are doing amazing work with the Michigan Medicaid population, including Detroit Wayne Integrated Health Network and Oakland Community Health Network, who are providing critical behavioral health services. We provide them with technology that identifies gaps in care and ensures that information is delivered to the hands of providers and care managers. In this data-driven world, various entities are responsible for providing care to Medicaid population who are not in receipt of the most current core healthcare information. We support Michigan Health Information Network and believe they can help in unifying Medicaid members' healthcare data across the state. We are currently doing this today here in Michigan because historically the behavioral health data and the physical health data is separate. By the time it is shared with the respective stakeholders, the data has aged and become inherently less valuable. This means programs and services are not as efficient and effective as they could be. By bringing the physical health and behavioral health data together, you can use data science and artificial intelligence to build predictive models and intelligently automate next best actions to all stakeholders providing care. However, artificial intelligence can be scary if not implemented safely, in a way that does not create and facilitate biases and ensures human oversight of prescriptive next best actions. Predictive models that are siloed and deployed by individual stakeholders is not the solution. The data, the models, and embedding into the existing workflows is. Vital Data Technologies deployed AI-driven utilization and care management technology solutions that are used across the country by plans and providers. We have built and deployed dozens of predictive models over the last 7 years. Our predictive models identify members that are most likely to be emerging high-cost members, substance use disorder, undiagnosed depression, preterm labor and delivery, just to name a few. By being able to identify Medicaid recipients that are most at risk, we automate engagement to various stakeholders that can help adjust trajectory and care to ensure they are being engaged, educated, referred, and that the best action is taken. This can aid with healthcare worker shortage, getting people connected to care quickly and preemptively. More efficient and effective use of workers providing care will ensure that money being spent is allocated to patients with the highest risk, providing prescriptive actions to alter that care trajectory. We are asking the committee to allocate $1 million for a pilot project. The proposed pilot would leverage our existing customers and bring MDHHS and physical health plans to the table to share data, build predictive models that can be embedded into their existing workflows for maximum impact. We have support from entities like Detroit Wayne Integrated Health Network. Our existing relationships and understanding of the Michigan Medicaid system will help launch the pilot project, and successfully we are confident that project will provide significant qualitative and quantitative value. Thank you.
Do we have any questions from the committee? No questions. Thank you for joining us today.
Thank you.
Next, we have Philip Berquist, CEO of Michigan Primary Care Association.
Good morning. As Chair Morse said, Philip Berquist, CEO of the Michigan Primary Care Association. MPCA's member health centers operate about 400 healthcare delivery sites across the state and care for about 1 in 14 people in the state of Michigan. Sometimes community health centers are called by their more formal name, federally qualified health centers, or FQHCs. They're one and the same. Community health centers are nonprofit, patient-directed organizations that are based in delivering primary care in an integrated service delivery model. So primary care, behavioral health, substance use, dental services, vision services, pharmacy services, all in one place as part of an integrated care team. Our healthcare landscape has shifted quite a bit in the last few years, from the impacts of health workforce shortages to really significant needs for patient engagement in preventive care and catching up on services that were postponed during the pandemic. But among all of the challenges that are facing health centers today, rising costs in delivering services are really the biggest one, the one that they are facing with the greatest sense of urgency. From the cost of maintaining facilities to the gloves that people wear, the syringe that they might use for a vaccine, kind of their salaries and wages day to day, costs have really shifted in the last few years. Today, it costs meaningfully more to deliver healthcare services than it did even a few years ago, and that's continuing to go up. It's certainly not a plateau status. I think the best example of those rising costs is actually the wages and salaries of health center staff. So if we compare the end of last year to right before the public health emergency in 2019, the wages of health center staff have gone up $74 million annually. That isn't to add staff or grow services. It is to employ the same people working in healthcare that worked in care 4 years ago because of competitive wages, job opportunities elsewhere, and really needing to compete to keep the team members that are critical to the services that people rely on. Two of the most common misconceptions about health centers is that they receive enough federal funding to make up the gap in low insurance reimbursement, and that their Medicaid payments are based on the cost of delivering services. And unfortunately, neither one of those things is accurate. Most health centers have about 30 or less % of their budget made up in federal funds. In large organizations, as often as low as 10%. And in Medicaid, payments are based on costs from over 20 years ago that have only been have received small updates each year. Research from Health Management Associates kind of puts a number on this, and a number that's really easy to remember. In every Medicaid visit a health center provides, they are short $97. Said another way, it costs almost $100 more to provide every Medicaid service a health center provides to a patient than the cost of actually delivering those services. There's an opportunity and a real request that we have to bring forward today, which is, to maintain the services that Michiganders are counting on from health centers, we need a $40 million gross or $14 million general fund investment to stop more dire consequences from occurring. Those dire consequences are things like reduced access to services and really seeing care teams that folks are relying on reduced. I really appreciate the time today, and I'm happy to answer questions.
Thanks, Philip, for being here today. Appreciate your work. Do we have any questions from the committee? Not seeing any. Thank you so much. Next, we have Cherie Long, CEO of Heart of the City, joining us virtually.
Hello, can you guys hear me?
We can hear you. Go ahead.
Hi, I'm Cherie from Heart of the City. I'd like to say thank you, Madam Chair and Subcommittee, for having me today on speaking. As I said, I am founder, CEO of Heart of the City Development Center here in Saginaw County. We work with intellectual and special needs individuals ages 17 to 26. We found a need in the community where there needed to be services for those who are aging out of the school system. I am, a little background, a mother of a child with a disability who is aging out of the school system. I am also a social worker. I found a need for services beyond the age of 26 that weren't clinically based. For our organization to date, we have served about 2,000 participants through grant funding and other funding. Our target population are those ages 26 and above to age 55. We found that many of them don't have access they need in the community to resources. Either they are not able to navigate physically, or they are unable to just communicate that need. We started our services through social events, which is where the 2,000 participants came in at. We also launched our program this past Friday, April 5th, which brought out 75 families. Our services that we're offering gives them access to community. We give them access to lifelong learning skills, maintaining those critical learning skills. We also give them courses such as money management. And we also support the families as well as the participants through support groups. We offer support groups in these services, not just for the participants, but for the families to maintain their jobs. A lot of families are quitting their jobs to care for their loved ones with disabilities, which as a mom and as an advocate, I feel they shouldn't have to do. I feel that we should be collaborating, as I do, with many organizations, such as Saginaw Community Mental Health, Bay Area Neck ISD, Saginaw ISD, the Saginaw YMCA. I am not looking to take over services, but I am looking to collaborate to offer more service, more systems for these families to be able to, one, keep their loved ones in their homes and not have to place them in AFC homes if necessary. I am looking to offer those supports to families like myself who are low income and can't afford many of these options, or to send their loved ones out to centers. A lot of these individuals also don't qualify for childcare. I know there's a big push for childcare in Michigan, but I think we're forgetting that these individuals, as my daughter, are born with a disability. They will always need care. Not all of them, but a good majority of them will need care for the rest of their lives. I know as an adult, as we get older, we will all cognitive decline. So I just want you guys to imagine being born, needing help all of your life, or needing assistance. And this is why I started this service. This service is needed. And a lot of our families are suffering in Michigan, preferably in the Saginaw County area where I'm from. And they are not able to care for their loved ones or even work because they don't have the support they need. These individuals are suffering from mental health issues.
Ma'am, I'm sorry.
Because
Can you wrap up because we have to give everyone equal time? So if you can just kind of tidy up there at the end, thank you.
Okay, so what I'm asking for is $800,000 to help support this program in collaboration with other services in the county to offer services to this population that is much needed. Thank you. Any questions?
Thank you so much for testifying. Any questions?
Chair?
Oh,
Chair. Can't find my here.
oh, Rep. O'Neill. Sorry, we didn't know who was speaking. Go ahead.
Thank you, Madam Chair. Thank you, Ms. Long. Just one question. Do you have a physical structure for services for the community?
Yes, we attained a structure that we'll be moving to on June 1st. It is the old Saginaw County Community Mental Health Building located in the city of Saginaw on Hamilton Street.
Is that donated or how does that work? Is it just utilized?
Right now, it is not donated. I am paying out of pocket along with grants and donations to maintain this facility because I feel it is needed in the community.
Thank you. Thank you, Madam Chair.
Thank you, Rep. And thank you, Shuri, for being with us today. Next, we have joining us virtually Ben Moe, President, Michigan Network for Youth and Families. Ben Moe, if you're still on with us, you can go ahead. Okay. So moving on, we have Jim Kasha. Just make sure you press the mic button. Thank you.
Thank you, Chair Morse and committee members. Good morning. My name is Jim Kasha. I failed, and some kids died as a result, and many kids suffer and are still suffering. I'll try to do better. Would you rather live in a world without guns or a world without mentally disabled children? If your answer is the latter, I ask you to appropriate a significant amount in the 24-25 year budget for a Healthy Brains for Children initiative, focused on providing proper prenatal care to all Michigan moms with an emphasis on the elimination of alcohol and all other brain-destroying toxins, but especially alcohol, from the diets of our unborn children. We were almost there in 2013, 2014, when former State Senator Molnar addressed this issue in his Health Policy Committee, Appropriations Committee for the Senate. He put in a line item for, after requesting a report from MDCH, he put in a line item for this. Unfortunately, it never made it to the full budget. I come to the legislator, as I have many times in the last 18 years, pleading for help for Michigan's long-neglected foster children, still 15 years later under federal judicial oversight. Many of these children suffer from fetal alcohol spectrum disorders, FASD. Prenatal alcohol exposure has been linked to many mass school shootings. I told the legislature this years ago. Tomorrow, James and Jennifer Crumley will be sentenced by the people of the state of Michigan for their role in the mass school shooting committed by their 15-year-old son, Ethan. But do we really know the role? And what was the state's role? It was widely reported that several neighbors phoned Child Protective Services when the 6 to 9-year-old Ethan was left home alone while his parents went drinking. What is not known is how CPS responded. We do know that CPS failed to protect Ethan and help the Crumleys, that is clear. Let us put down the stones. This is the time to heal. There's nothing meaningful to gain from further persecution of the Crumleys. It's futile, hopeless. Being filled with so much hate, you have all missed the perfect opportunity to understand why children kill children. James and Jennifer could have helped you understand. They still can. I hope they will have the courage to do so. Prosecutor Mark Keast has called Jennifer Crumley a liar. Keast wants to know the truth about Jennifer's drinking. Jennifer should tell him. This is not the first time Prosecutor Keast has brought up the issue of Jennifer's drinking. Keast brought it up at Ethan's Miller hearing. I say, Keast, you can't handle the truth. The last thing Assistant Prosecutor Keast and Prosecutor Karen McDonald want is for Jennifer and James to tell us the truth. Judge Cheryl Matthews denied James and Jennifer the opportunity to attend Ethan's Miller hearing, but did they get a chance to watch it? Did the Crumleys hear Prosecutor Keast ask the state's expert witness, forensic psychiatrist Dr. Lisa Anaker, MD, whether it was possible their son Ethan has fetal alcohol syndrome? Dr. Anaker stated that Ethan does not have FAS, and he may not, but he may have a fetal alcohol spectrum disorder.
Jim, so
It's a
sorry
loyal
to
check.
interrupt. Your time is up. If you could just wrap it up, thank you.
I just have a few more lines here. If you can let me, I'd appreciate it. I came a long way. How does Anaker know that? How did she rule that out? Has anyone ever asked Jennifer if she drank alcohol while pregnant with Ethan? Another expert thought it was possible. His opinion piece was published in the Detroit News, along with a follow-up Detroit News editorial suggesting Ethan be properly evaluated for a fetal alcohol spectrum disorder. Why wasn't it done? Jennifer knows if she was drinking alcohol when pregnant with Ethan. James knows. Family members and acquaintances likely know. Will someone please tell us the truth? It's not a crime, Jennifer. You didn't know that drinking alcohol while pregnant could turn your child into a mass school shooter. Why would you know that? Prosecutor Keast and McDonald don't know that. Don't they want to know? Tell them, Jennifer. Tell us, Jennifer.
Okay, do we have any questions? Seeing none, thank you for being here today. Next, we have Sean Bennett, who I believe left the room. Sean Bennett? Okay, next we have Crystal Bailey.
Thank you, Madam Chair, and the committee members for the opportunity to speak at public comment today. I'm Crystal Bailey, born and raised in North Detroit and residing in Oak Park. I came here today in hopes that rehabilitation opportunities is spelled out and defined within the state's juvenile mission statement. The state of Michigan is in a mental health crisis across the entire state, from the youth to adults. In 2018, I worked in Oakland County Juvenile Justice Department, and I volunteered to take kids on jail tours to deter them from incarceration. I noticed in the adult jails there were multiple inmates who appeared to be mentally ill. Today, I have firsthand experience into the juvenile justice system and how there is little to no resources available for the youth who are battling mental and/or behavioral health issues. The bedding crisis the state of Michigan is facing is leaving children to wait months, if not years, and worse, they may age out before even being rehabilitated in a lockdown detention center rather than receiving treatment such as rehabilitation that is mentioned in the Juvenile Justice Mission Statement, which is to ensure all youth and families of diverse populations involved in Michigan's juvenile justice system have equitable access to a continuum of research and evidence-based services that provide rehabilitation opportunities in a safe, supportive, and respectful environment that honors the youth and families' voices. We need more funding towards mental and behavioral health residential facilities with a legal description for rehabilitation to help our children in this crisis. Thank you again.
Thank you for being here and your advocacy. Anyone have any questions for Crystal? Seeing none, thanks again. And that concludes all the known individuals who wanted to testify today. So we'll make last call for people wanting to provide public testimony to the committee. Going once, going twice. Okay, well, thank you everyone who took the time to testify before the committee today. We truly appreciate your advocacy and the work that you all do in the community that touches the HHS budget. And we look forward to completing the budget process this year and helping the citizens of the state of Michigan as much as we possibly can. And seeing no further business, this committee is adjourned.